It's past 10 p.m. The house is quiet. You feel a little hungry. So, you grab something small, maybe leftovers, maybe a sweet snack, thinking it's harmless. But what if I told you that this simple late-night habit could be quietly forcing your heart to work harder, slowing its recovery, and increasing heart attack risk after 50 without you feeling a single warning sign? After 50, your heart doesn't respond to stress the way it used to. And eating late at night creates a kind of stress most people never connect to heart health. Let me explain this in a way that's simple, real, and backed by science. When you're younger, your body is flexible, your metabolism is faster, your blood vessels are more elastic, and your heart can adapt quickly to changes like eating late, sleeping less, or digesting heavy food at night. But after 50, something important changes. Your heart begins to rely more heavily on predictable rhythms, especially the daily rhythm between eating, resting, and sleeping. Doctors call this the circadian rhythm, but you can think of it as your heart's internal clock. During the evening and night, your heart is designed to slow down, lower blood pressure, reduce heart rate, and repair itself. This nighttime recovery is critical. It's when inflammation drops, blood vessels relax, and your heart muscle gets a break. Now here's the problem. When you eat late at night, especially after 8 or 9 p.m., your body receives a signal that says, stay active, stay alert, start working. Digesting food is not a passive process. It demands energy, oxygen, and increased blood flow. That means your heart has to pump harder right when it should be resting. After 50, this mismatch becomes dangerous. Your heart is trying to slow down for the night, but digestion forces it to speed up. Blood pressure rises slightly, blood sugar spikes. Stress hormones like insulin and cortisol increase. Over time, this repeated nightly strain adds up. Many cardiologists now describe late-night eating as a silent workload on the aging heart. And here's why this matters more than most people realize. At night, your blood vessels are naturally narrower than during the day. This is normal. But when digestion demands more blood flow, your heart must push harder through tighter vessels. That increases pressure inside the arteries, especially coronary arteries that feed the heart muscle itself. For someone over 50, whose arteries may already be stiffened by age or plaque buildup, this extra pressure can reduce oxygen delivery to the heart. You may not feel chest pain. You may not feel shortness of breath, but the heart feels it. This is one reason heart attacks and dangerous heart rhythms occur more frequently at night and in the early morning hours. Now let's talk about blood sugar, because this is where things get even more serious. Eating late at night, especially carbohydrates or sugary foods, causes a larger blood sugar spike than eating the same food earlier in the day. Why? Because insulin sensitivity drops at night, and it drops even more after 50. That means your body struggles to clear sugar from the blood. High nighttime blood sugar damages blood vessels from the inside. It increases inflammation and oxidative stress, to major drivers of heart disease. Over time, this damage stiffens arteries and weakens the heart's ability to relax properly between beats. Many people think, I'm not diabetic, so this doesn't apply to me. But studies show that repeated nighttime glucose spikes can harm the heart even in people without diabetes, especially older adults. And there's another issue almost no one talks about. Late-night eating disrupts sleep quality. Even if you fall asleep easily, digestion keeps your body in a semi-active state. Your heart rate stays higher than it should. Blood pressure doesn't dip enough. Deep sleep becomes shorter and fragmented. This matters because deep sleep is when the heart repairs microscopic damage from daily stress. Less repair means more wear. Over months and years, this leads to higher risk of high blood pressure, irregular heart rhythms like atrial fibrillation, and heart failure, particularly after age 50. In fact, research shows that people who regularly eat late at night are more likely to have non-dipping blood pressure, meaning their pressure doesn't fall during sleep. Cardiologists consider this one of the strongest predictors of future heart events. Now let me tell you something that surprises many people. It's not just what you eat at night, it's the timing itself. Even light foods can trigger this chain reaction. A bowl of fruit, a sandwich, a glass of milk with biscuits. The digestive signal alone is enough to disturb the heart's nighttime rhythm. Your body interprets late eating as a cue to stay in day mode. And at 50, your heart desperately needs night mode. There's also the issue of acid reflux, which becomes more common with age. Late meals increase reflux, which can stimulate the vagus nerve, a nerve that directly affects heart rhythm. This can cause palpitations, skip beats, or nighttime chest discomfort that people often mistake for anxiety. But the heart is involved, and here's the most dangerous part. Because this damage happens slowly, people don't connect it to their eating habits. They blame age, they blame stress, they blame genetics. They never blame the late-night plate. I've seen people with normal cholesterol, decent blood pressure, and no obvious symptoms, yet their heart tests show early dysfunction. When their routines are examined, one habit appears again and again, eating close to bedtime for years. The heart remembers patterns, and after 50, it keeps score. After 50, your body goes through subtle but powerful changes that most people never feel until something goes wrong. One of the biggest changes happens in how your heart and blood vessels respond to timing. When you're younger, your arteries expand and contract easily. Your heart muscle relaxes quickly between beats. Hormones rise and fall smoothly throughout the day. But as we age, the heart becomes less forgiving. The walls of the heart muscle stiffen slightly, the arteries lose elasticity. The nervous system that controls heart rate becomes more sensitive to stress signals. This means your heart reacts more strongly to things that disturb its natural rhythm, like eating late at night. Think of it like this. Your heart after 50 is like an experienced worker who needs proper rest to function well. If you keep calling it back to work at night, even for small tasks, exhaustion slowly builds. Late-night eating sends multiple stress signals at once. First, digestion increases heart rate and blood flow demand. Second, insulin release affects blood vessel tone. Third, the digestive process raises core body temperature when it should be dropping for sleep. And fourth, the brain stays more alert, delaying full rest. All of this forces the heart to operate in a narrow window between work and rest. Now let's talk about which foods are especially hard on the heart at night, because this part is critical. Heavy meals are the obvious problem. Foods high in fat, salt, or refined carbohydrates require more blood flow to the digestive system. This pulls blood away from other organs and increases workload on the heart. Salty foods raise blood pressure at night. Sugary foods spike glucose and insulin. Fatty foods slow digestion, keeping the heart active for hours. But here's what surprises many people. Even foods considered healthy during the day can strain your heart at night after 50. Fruit late at night raises blood sugar more than in the morning. Whole grains digest slowly and prolong metabolic activity. Dairy can increase mucus and reflux, triggering heart rhythm changes. Large salads can cause bloating, which pushes against the diaphragm and affects breathing and heart rate. It's not about good or bad food, it's about timing. Now let's talk about a very common situation. Many people skip dinner or eat lightly, then feel hunger late at night. They tell themselves, I'll just eat a little so I can sleep, but that little snack often becomes a nightly habit. Over time, the heart adapts to this disrupted rhythm by staying slightly overworked at night. This reduces its ability to fully relax between beats, a condition doctors call diastolic dysfunction. It's one of the earliest stages of heart failure, and it often develops silently. People with this condition usually don't feel pain. They may notice mild fatigue, occasional shortness of breath when climbing stairs, or waking up feeling unrested despite enough sleep. Most never connect it to eating habits. There's also a strong link between late-night eating and weight gain around the abdomen after 50. This type of fat isn't just stored energy, it's metabolically active. It releases inflammatory chemicals that damage blood vessels and increase heart strain, even if total weight doesn't change much. Another overlooked issue is nighttime heart rhythm disturbances. After 50, the electrical system of the heart becomes more sensitive. Late eating increases vagal nerve stimulation and reflux, both of which can trigger irregular beats during sleep. People may wake up with a racing heart, skipped beats, or a sense of panic often blamed on anxiety or bad dreams. But the trigger may be digestion happening when the heart should be resting. Now let's talk about what cardiologists have started noticing in real life. Patients who stop eating late at night without changing medications or exercise often show improvements in morning blood pressure, heart rate variability, and sleep quality within weeks. These are measurable signs of reduced heart strain. This is why some heart specialists now recommend time-restricted eating, especially for adults over 50, not for weight loss, but for heart recovery. Giving the heart a longer overnight rest window reduces inflammation, improves insulin sensitivity, and allows blood pressure to dip naturally during sleep. The heart doesn't need extreme diets, it needs predictable rest. So the question becomes, how late is too late and what can you do instead without going to bed hungry or uncomfortable? For most adults over 50, cardiologists agree on one simple rule that protects the heart: finish your last proper meal at least 3 hours before bedtime. This gives your digestive system time to slow down before your heart enters its nighttime recovery phase. If you usually sleep at 11 p.m., aim to finish dinner by 8 p.m. If bedtime is 10 p.m., finish by 7. This window allows blood sugar to stabilize, heart rate to drop naturally, and blood pressure to follow its healthy nighttime dip. Now, this doesn't mean you can never eat in the evening. But there's a big difference between a late meal and a small, strategic snack. If you truly feel hungry close to bedtime, the goal is to avoid triggering digestion stress. That means choosing foods that are easy to digest, low in sugar, and small in portion. A few examples that are generally gentler on the heart at night include a small handful of nuts, a few bites of yogurt, or warm herbal tea without sugar. The key is not fullness, the key is calm. Large portions, sugar, heavy carbs, and salty foods should be avoided late because they activate the heart instead of calming it. Another powerful change is consistency. Your heart loves routine. Eating dinner at wildly different times each night confuses your internal clock. After 50, this inconsistency increases heart strain more than occasional late eating. Even on weekends, keeping dinner within the same 1-hour window helps your heart settle into a predictable rhythm. There's also something important about how you eat in the evening. Eating slowly, chewing well, and stopping before you feel full reduces digestive demand. Rushed eating late at night raises heart rate and stress hormones more than the food itself. Now let's talk about what many people notice when they stop eating late. Within 2 to 3 weeks, many adults over 50 report better sleep depth, fewer nighttime awakenings, lower morning blood pressure, less acid reflux, reduced palpitations, more energy in the morning. These changes happen because the heart finally gets the rest it's been missing. And here's something reassuring. You don't have to be perfect. Even reducing late night eating to a few days a week can significantly reduce nighttime heart strain. The heart responds quickly to relief. One more important point. If you're taking heart or blood pressure medications, late eating can interfere with how these drugs work overnight. Blood pressure medications rely on nighttime dipping to be effective. When digestion keeps pressure elevated, medications may appear less effective, leading to unnecessary dose increases. Sometimes the issue isn't the medicine, it's the timing of meals. Now, a gentle but serious warning. If you regularly wake up at night with chest discomfort, shortness of breath, a racing heart, or pressure that improves when you sit up, don't ignore it. While digestion can contribute, these symptoms should always be discussed with a healthcare professional. This video is about prevention, not replacing medical care. But for many people over 50, One simple habit, eating earlier, can quietly protect the heart more than they realize. Your heart doesn't ask for much. It asks for rest, rhythm, and recovery. And when you stop interrupting its nighttime repair work, it rewards you with strength, stability, and resilience. Before you sleep tonight, take a moment to think about your heart, not with fear, but with awareness. Most heart problems don't begin with sudden pain or dramatic warning signs. They begin quietly, through small daily habits that seem harmless at the time. Eating late at night is one of those habits. It doesn't feel dangerous, it doesn't hurt, but after 50, it slowly steals something your heart depends on most: its time to rest and recover. The good news is that this is not a complicated problem, and it doesn't require extreme diets or strict rules. It's about timing. It's about respecting the natural rhythm your heart follows every day. When you give your heart those extra hours of calm each night, you reduce strain, lower inflammation, and allow healing processes to do their job. Think of your evening routine as a signal you send to your heart. When you eat earlier, slow down, and let your body settle, you're telling your heart, it's safe to rest now. Over time, that message makes a real difference. If this information helps you see your health differently, share it with someone you care about. Many heart problems are preventable, but only if people know what to watch for. And if you want more science-backed, easy-to-understand guidance on protecting your heart after 50, stay connected here. Your heart has carried you this far. Tonight, give it the rest it deserves.